Dr. Janssen offered John 4 options: do nothing and live with the pain, steroid shots for temporary relief, fusing the spine together using vertebral fusion. This, however, would limit John's mobility, or a newer option.
The most exciting revolutionary technology that we have available for patients now is to be able to do disc replacement surgery.
Dr. Janssen was familiar with disc replacement surgery through his professional organizations, which explore and share the latest spine research and treatment.
I've been very fortunate and was honored to be elected as the chairman of the largest international group of spine specialists throughout the world, and that's called AO Spine. It's based in Switzerland, but we have over 10,000 clinicians, healthcare providers in this international nonprofit society.
AO Spine is a division of the 50-year-old AO Foundation, and its mission has direct benefits for both surgeons and their patients.
It's an open fraternity. It's there to really spread and share knowledge and wisdom about spine surgery.
Michael Piccirillo is the executive director of AO Spine International, a Swiss-based foundation for 8,000 surgeons worldwide.
The key is that, as I travel around the world meeting these surgeons and the surgeons meet each other, I think the benefit of such an organization is the fact that they learn different techniques.
By having an international and a global society of spine specialists, we're able to transfer knowledge and gain knowledge of both research, clinical expertise, patient outcomes, development of advanced technology across the globe now.
Through dialogue, through the community, through knowledge, through sharing ideas with each other, people can make up their own mind based on their own skill mix and their own confidence.
Well, the latest and newest for spine surgery is motion preservation. So anything that preserves your motion. An artificial disc in the low back, which has been FDA approved now for 2 or 3 years.
Dr. Terrence Piper is a spine surgeon from St. Peters, Missouri. He meets with Dr. Janssen and other spine surgeons on a regular basis at the Spine Education and Research Institute in Thornton, Colorado.
The purpose of the seminars that Dr. Janssen and I conduct is to try to educate practicing surgeons, typically men and women after their residency and fellowship program, to try to educate them and make it so that they become facile in surgical techniques in treatment of spinal degenerative conditions, spinal degenerative disorders.
Just like orthopedic applications of total knees, total hips, elbow replacements, and finger replacements, we now have available mechanical devices to replace these discs when they deteriorate and allow the patient to continue motion over time. And it's an exciting alternative to really improve patients' quality of life. Probably about 60% relief of your symptoms.
After consulting with Dr. Janssen and researching disc replacement surgery on the internet, John was convinced it was the right solution for him. He agreed to be part of a field trial conducted by the Food and Drug Administration.
This is a mechanical device where the entire disc was completely removed and we replaced it with a mechanical moving disc. It's very similar in materials to what we have in total knees and total hips. It's a plastic and metal moving disc that has replaced the discs that were severely degenerative. The life expectancy of this technology is probably somewhere between 2 to 3 decades of life.
John was amazed by the success of the operation.
At 8:30 the next morning, the occupational therapist had me up and I had to walk down the hallway and down a flight of steps, back up a flight of steps and back to my room. The surgery was done on a Wednesday, and within 6 weeks, I was feeling better than I had felt in probably 5 years as far as my back was concerned.
I thought he would do well with having surgery because he's very motivated and wanted to get better. I know we gave you a lot of information today. Initially after the surgery, when I saw him in the hospital the next day post-operatively, he already noticed a big change in the way his back felt. Even though he had surgical pain, he was feeling great. He was just so positive. He only stayed in the hospital for 1 day.
After the brace was removed, At probably 2 months, I started doing physical therapy, which consisted of a lot of stretching, core strengthening exercises, isometric exercises.
Physical therapy was started after his 6-week period, and then he was starting to do some bending. And currently, John, I think he's about 3 years out. He's doing everything. He's coaching football, he's even playing football, he does everything he wants.
I have absolutely no pain whatsoever, and I had forgotten what that felt like.
For Linda and John, there's a happy ending to their stories with 2 different types of treatment. For Linda, a conservative treatment combining physical therapy with intramuscular stimulation. And for John, the revolutionary disc replacement surgery, which enables a return to full movement in most cases. Coming up, we'll take a look at how degenerative disc disease may be treated in the future through stem cell research, effective education, and some that sound downright bionic.
The solutions to degenerative disc disease we describe today are not for everyone, and a course of treatment must be decided on a case-by-case basis. As we move into the future, treatment of lumbar pain is sure to see some dramatic changes.
Anything there?
Therapy for intramuscular stimulation is promising for those with degenerative disc disease, but it may not work for every patient.
In my experience of using intramuscular stimulation over the course of the past 8 years, I have found some significant changes in the outcomes of patients with degenerative disc disease. I want to be very clear that it's not for everyone. Patients have fairly a 50-50% chance of getting better or not, and I think this really depends on the stage of the degenerative spine.
It has worked well for Linda.
What was unfortunate when this injury first took place was that it was right before the holidays. So all of our holidays were pretty much put on hold. Now that the treatment has really taken effect, it's totally different. I'm able to work longer hours, spend more time with my family.
Disc replacement surgery is another treatment that isn't for all patients with degenerative disc disease, but it's becoming a more popular option for many.
My practice has changed dramatically in the last 5 years with disc replacements. And now we have a number of disc replacement procedures in both the cervical spine and in the lumbar spine that are FDA approved that can dramatically improve patients' quality of life.
John Ireland is certainly one success story.
My lifestyle has completely gone back to even better than it was before. My back feels better than it's felt since I was 20 years old.
John has returned to full activity, passed all of his physicals, has no restrictions whatsoever, and is continuing to serve what he enjoys the most, which is his career and his talents in firefighting, where he's able to make differences in patients' lives and to save patients and help teach firefighting at full activity with no restrictions.
And as technology advances, so do treatment procedures.
I think in the next 10 years we'll even have more exciting technologies. We'll be able to treat them on a more of a biological or cellular level to not only prevent the deteriorative process, but also be able to have some reversal aspect when the tissues are deteriorative by doing biological injections or some stem cells, or be able to regrow some of these cells and to be able to help these patients benefit.
Excellent.
All of the medical experts we spoke to emphasize that early diagnosis is critical, and surgery should be considered only after you've tried several months of non-surgical treatments for your lower back pain. Many new surgical procedures can be performed using minimally invasive techniques. These techniques result in smaller incisions, less pain after surgery, and a faster recovery. Well, that's it for this edition of Healthy Body, Healthy Mind. I'm Carlos Pagan. See you next time. For more information